I'm Dr. Angeline and I'm here to answer the 10 most Googled questions about body sculpting. Wait, chup, 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 chup. So, firstly, what is body sculpting and how does it differ from weight loss? Okay, let me give you a bit of context. So basically, body sculpting and body image has been a big thing in the recent years. And there was a data by the American Society of Plastic Surgery in 2013 mentioning that there is a significant demand of non-invasive treatments, and it has increased by about 500% because there has been an increase of risks and complications with surgeries. So you can see the trend of everybody going towards body sculpting treatments. So the question is, how does it differ from weight loss? Basically, when you sculpt the body, when you tone the skin, or when you break down the fat, when you tone the muscle areas with these non-invasive body sculpting treatments, you do not have any weight loss. It's a little bit different because when you do body sculpting, you are losing spot areas. You're not losing a systemic area, which means the full area of the body. So we are targeting specific areas in the body where we want to lose or shapen the area. And this definitely differs from weight loss. The second question, what are the main types of non-invasive body sculpting treatments available? So the main types of body sculpting treatments that are available will target 3 layers of the skin. So we target the skin layer, the fat layer, the muscle layer. The skin layer, we have treatments like skin tightening treatments like lasers, radio frequency, ultrasounds actually to tighten up the skin. And then for the fat layer, we have things like cryolipolysis, which is fat freezing. I think everybody has heard of that, and is actually quite popular in the market these days. And also radio frequency targeting adipolysis, which means the breakdown of fat cells, and also targeting the muscle, your core. And who doesn't want more of that? All right, how does CoolTech work to eliminate fat? All right, so CoolTech uses this technology called cryolipolysis. In the early days, many years ago, a Harvard professor actually observed something called the popsicle paniculatis. He observed kids taking lollipops, cold lollipops, and sucking them, and they found out that these kids actually developed dimples. So we know that fat is very susceptible to cold temperatures, and it doesn't affect the muscle, the nerves, and all the other layers of the skin. So basically, what happens is they extrapolated this data and they use this data to create machines to cause this very targeted fat loss using this method called apoptosis, which means the breakdown of fat cells, but with a temperature of -8 to -11 degrees. And this will cause permanent reduction, permanent fat loss in that selected area. What are the benefits of M-Sculpt Neo compared to traditional workouts? So M-Sculpt Neo is another amazing technology that has surfaced in the market, and it is like no other. And I think for me, I always believe in originals. There's a lot of technology that has copied M-Sculpt Neo, but they have not been able to reproduce the same results, number one. And number two, they do not have a huge amount of scientific data backing the machine. So M-Sculpt Neo uses high-intensity focused electromagnetic technology. So what does M-Sculpt Neo do? M-Sculpt Neo actually increases muscle mass by 25% and decreases fat loss by 30%. If you put this machine on the tummy, it's akin to you doing 20,000 sit-ups. Or if you put it in the buttock, it's akin to you doing 20,000 squats. I don't think anybody is up to doing 20,000 squats in half an hour. So basically, this machine does it for you. And I find that this technology is amazing. And M-Sculpt Neo is a generation after M-Sculpt. So what it does is it can target different areas of the body, not just the tummy and the buttocks like the classic M-Sculpt. It can also target the flanks, the arms, the triceps, the biceps, the inner thighs, the outer thighs, the back of thighs, the front of thighs, and even your calves. So basically, it is a full body, non-invasive body contouring to improve your muscle mass and reduce the fat. I think that's amazing. What is the next question? Is mesolipo an effective way to target stubborn fat pockets? So firstly, what is mesolipo? Mesolipo is made out of two terms, meso and lipolysis. Meso is a series of injections. Lipolysis is the breakdown of fat. So basically, it's a series of injections to break down fat. So mesolipo can target a lot of those tiny pockets of fat in the body that's super stubborn and doesn't go away with any exercise. And we are looking at areas like the double chin, or maybe sometimes around the bra bulge areas, or the arm areas, or even some patients who have tiny flanks. We are targeting only small stubborn areas. I would not suggest to do mesolipo for bigger areas. The reason being, there is a limitation to the amount of solution that we can give to the patient safely and injected safely to the patients. There are a lot of different types of mesolipo solutions in the market. So know your provider, because your provider should be able to explain exactly what is inside the content of these products. Sometimes these mesolipo products can cause downtime. You're looking at things like swelling, bruising, and if the provider doesn't inject in a sterile condition, then you would have things like infections and even necrosis. So we don't want anything bad to happen to you because of any aesthetic procedures, right? So make sure you're done, any injections are done with a professional, a doctor who knows their products. I think that is very important. Next, which areas of the body can be effectively treated with body sculpting? As mentioned, stubborn areas of the body can be treated with body sculpting. We can actually treat the face area, the neck area even, the arms, the flanks, the tummy area, the thighs, and even the calf areas. But then again, every single area is limited to the type of technology that we can use for that area. Also, the downtime that the patient allows us to give them for that specific area. What are the potential side effects of body sculpting treatments? So with body sculpting treatments, you have some treatments that have downtime and some treatments that doesn't have any downtime. But even the treatments that doesn't have any downtime can have side effects, because as we all know, all these treatments are medical grade treatments, so every medical procedure has its side effect. So for example, like non-invasive body treatments for patients who want to undergo M-Sculpt, who has a pacemaker, and if you want to treat, for example, like males who want to treat their man boobs and they have a pacemaker, it is not allowed because the metal will interact with the technology and it can eventually give you a heart attack, which is not what we want. So those patients are absolutely contraindicated. And things like the cool sculpting, it's quite a popular treatment because most of the patients can do it. However, there are some patients who are not able to proceed with cool sculpting. For example, patients who have any autoimmune disorder that are very sensitive to cold, or even patients who have very high expectations. These are patients that are not very good candidates for cryolipolysis. For injections like mesolipo, of course, there are some side effects. So you have some bruising, some swelling. So for patients who don't want any downtime, this is not the ideal treatment for them. What are the potential side effects of body sculpting treatments? With every medical treatment, there is bound to have a side effect. And for example, if you have a patient who has pacemaker, and if this patient wants to undergo M-Sculpt for this area or radio frequency for their man boobs, I don't think it is it's definitely contraindicated, because the machine will interact with the pacemaker and you eventually give him a heart attack. So that's not something that we want. All right. The other potential side effects with non-invasive treatments are things like, for example, like cryolipolysis. There is a term called PAH, paroxysmal adipose hyperplasia. So let me just give you a side story. There is a very famous celebrity called Linda Evangelista. She made this very public, and a lot of patients was scared of cool sculpting at this point. So who is Linda Evangelista and what did she do? Basically, she's a famous actress and she undergo multiple sessions of cool sculpting in her body. And what happened was she developed PAH. So the areas which were treated actually expanded instead of reduced in size. And that is not something that we all want from cryolipolysis. We expect to be slimmer and more toned. However, she became bigger. This happens in 1% of patients, and it is called the butter stick effect. So basically, the cells, instead of shrinking, it expands. So this is one of the risks of PAH, which some providers do mention to their patients, but some providers do not actually mention to their patients. So we have to be careful with what cryolipolysis machine that we use, and we have to make sure it's safe. And the other things are basically like your mesolipo injections. Mesolipo injections is a series of injections that has different cocktails of products. So side effects of this, some patients can have some allergic reaction to the mesolipo injections. So again, please know your provider and ask them questions about what they are injecting. I sometimes get very scared when my patients tell me, I don't know what my doctor did, or I don't know what was injected. So this is very tricky because if you don't know what is injected, we don't know how to treat it, right? So let's get on to the next question. Are there any medical conditions that would make someone unsuitable for body sculpting treatment? Firstly, if we refer to the M-Sculpt, you cannot have any pacemakers or any metal implants in the body. For patients who would like to undergo things like cryolipolysis, you cannot have any autoimmune disorders that make you very, very sensitive to cold. And also, of course, with mesolipo injections, you're looking at targeting the fat using injections. So patients who are on anticoagulants or have high bruising are not able to clot. These are the patients that we will absolutely inform them in advance if they really, really want to do, or just give them an alternative treatment instead of injections because the downtime would be much, much longer. I will also want to highlight that with all these body sculpting treatments, I always like to get down to the why the patients are doing certain treatments, because if they have something called body dysmorphia, which means that nothing we do can actually satisfy them, and they usually come in quite skinny already and they want even more. If they are within this category of patients, then I will usually say no to recommending treatments to them, or I take their attention away from body sculpting to maybe face treatments. It really depends on the initial consultation. Are body sculpting treatments permanent? Wow, this is a big question. So basically, one thing I would like to share, body sculpting is, like we said, targeting the skin, the fat, and the muscle. So as we age, our skin, our fat, our muscle will also age. So aesthetics is all about maintenance. So nothing is permanent. But we know that specifically for fat cells, after the age of 18, you do not increase the number of fat cells anymore. So while you're doing treatments that will induce what we call apoptosis, which is natural cell death of the fat cells, by doing maybe cryolipolysis or radiofrequency treatments, these will actually eliminate those unwanted fat cells. However, if along the way you put on significant amount of weight, you do not increase the number of fat cells, but you will actually expand the fat cells that you currently have. But if say you lose that amount of weight, then that area will not come back again. Can someone actually get six packs with non-invasive body sculpting treatment? Okay, this is another popular question. There's two versions of this. There's invasive treatments and non-invasive treatments. So with invasive treatments like surgeries, there is a possibility of you getting these six packs because they will tone, they will tighten the muscle, they will cut down the fat, they will trim down the skin, and yes, you're able to get that six pack. But if you're referring to non-invasive body sculpting treatments, yes, it's possible as well, but you have to be the right candidate, which means your body fat percentage has to be low. You have to be having a good lifestyle already, and the doctor has to assess the skin, the muscle, and also assess your fat using body analysis machines to make sure that you are within that right candidate for us to promise or maybe give you that expectation that six packs is possible. I'm Dr. Angeline, and I hope that I answered your questions. If you have any other questions, you can visit us at neuclinic.my. Thank you.